Hello and welcome to BunMed, where we discuss concise medical knowledge that you can fit inside of a bun. Now let's have a look at a rarer cause of a thrombocytopenia, that of a heparin-induced thrombocytopenia. This is an iatrogenic disease, usually meaning that it's caused by healthcare professionals on the delivery of heparin. So if you've ever had a look at heparin before, you're probably thinking, hang on, what does heparin have to do with platelets? It works on our clotting cascade. So let's have a look at exactly how heparin leads to a thrombocytopenia. Here you can see we have a platelet molecule, and onto it we have this yellow thing known as a platelet factor 4. Circulating heparin, when it's been given, may actually come and bind to platelet factor 4. This may then lead to the formation of anti-platelet factor 4 and heparin complex antibodies. The reason for this is most likely due to the fact that heparin is often derived from other animals, things like pigs or cows. And so what actually is heparin-induced thrombocytopenia? Was the formation of antibodies against platelet factor 4 heparin complexes. And these antibodies are typically seen 4 to 5 days after the exposure of heparin, as they need time to develop. Now you're probably thinking, okay, that's not too big an issue, as our spleen will simply just churn out and take care of the platelets that have antibodies formed against it. Except the issue is, once the antibody binds to the heparin and platelet factor 4 complexes, the platelet actually becomes activated. And we know that activated platelet starts to spew out cytokines like ADP and thromboxane A2, activating other nearby platelets and causing them to aggregate together, forming these clots all over our body. These clots can then get deposited in the venous system, causing things like pulmonary embolisms or deep vein thrombosis, or they may get deposited in the arterial system, causing things like strokes or myocardial infarctions. So what are some risk factors for heparin-induced thrombocytopenia? Well, the obvious one is exposure to heparin, usually within the last 100 days. But the risk goes up significantly if the patient has had things like cardiothoracic or orthopedic surgery, where they are given high amounts of heparin, specifically high amounts of unfractionated heparin. And it is thought that due to the larger size of the unfractionated heparin compared to low molecular weight heparin, this increases the likelihood of forming antibodies against platelet factor 4 and heparin complexes. Is specifically compared to those who are having prophylactic dose heparin, which usually get low molecular weight heparin, so the risk is slightly lower there. So what sort of symptoms may we see in heparin-induced thrombocytopenia? Well, often the disease is completely asymptomatic and is picked up by coincidence on a blood test. However, if these platelets get deposited in the venous system, we may see things like signs of a DVT or a PE, or if they get deposited in the arterial system, we may get symptoms of a myocardial infarction or symptoms of a stroke. So what kind of investigations may we want to do once we suspect heparin-induced thrombocytopenia is going on? Well, we often detect it, first of all, detect the thrombocytopenia with a full blood count, which usually shows a thrombocytopenia. Now, the thing to mention about heparin-induced thrombocytopenia is actually very, very rare. So it's really important to rule out other conditions that more commonly give you a thrombocytopenia, things like sepsis, things like liver failure. So it's very important to rule out these factors. However, if we are now still suspecting heparin-induced thrombocytopenia, we can do a thing known as the 4Ts probability scale. Now, we don't have to know a great deal of detail in the 4Ts probability scale, but it's important to just understand the principle behind it, and essentially it addresses 4 main domains: the degree of thrombocytopenia, the timing of thrombocytopenia, the thrombotic event soliloquy, which means the presence of other thrombotic events, and other cause of a thrombocytopenia. And it essentially scores these out of a scale of 10. And if you have a higher score on this, it means that you're more likely to have heparin-induced thrombocytopenia. Another thing that we can test for is something known as an HIT antigen assay. Now, this name is somewhat misleading because we're not actually looking for the antigen. What we're actually looking for is an antibody. So essentially, in this test kit, we have the platelet factor 4 and heparin complexes stuck to the side of the test tube. As we add in the patient's serum, we actually see if there is a strong antibody response towards it. Now, this test is quite sensitive, as it picks up about 90% of people who have these antibodies against the platelet factor 4 heparin complexes. However, It's very important to consider that normal people who have been exposed to heparin might also develop these antibodies and have no altered platelet function. So therefore, the next thing that we might want to check is a HIT functional assay, where essentially we look for the aggregation of the platelets in response to the antibodies being within the area. And if, say, for instance, we have antibodies and this is causing the platelets to become aggregated, this is more indicative of heparin-induced thrombocytopenia. And lastly, we should, of course, screen for, or if they have signs and symptoms of the complications, we should screen for these complications and actually thoroughly investigate them. So what's the management of heparin-induced thrombocytopenia? Well, as soon as we find out that it is actually heparin-induced thrombocytopenia or we suspect it, we should stop the heparin immediately. And we should use an alternative anticoagulant agent. Lastly, a very important thing to remember about heparin-induced thrombocytopenia is to not use a vitamin K antagonist, as there's a very, very high risk of skin necrosis to patients. So therefore, other forms of anticoagulants which are not vitamin K antagonists should be utilized. That concludes the video. Hope you guys found it useful. Please feel free to share and subscribe. And if you have any comments, leave them below and we'll get back to you as soon as possible. See you in the next one.